introduce myself and our panel. My name is Ahmad Zulazraie bin Zainuddin, who is our moderator for this webinar. And today we have Dr. Emanuel, who is psychiatrist. How are you today, doctor?
I'm doing great, Azrai. Thank you for asking.
The second one is Miss Afiqah Binti Muhammad Rafi, is one of the survivor patients from anxiety disorder. How are you today, Miss Afiqah?
I'm good, thank you for asking me.
The very experienced psychologist Wellinah Eva Guramon. Welcoming Dr. Wellinah.
Hello everyone, nice to meet you all. Thank you.
Next one is our counselor from Faculty of Psychology and Social Science from University of Zubaidah, Madam Mohshanthini Nair. For your information, she is the winner of the Best Counselor for the year 2021. A big applause for her and congratulations for the award.
Hello everyone, good morning.
The last is our Dr. Nurain Zubaidah Binti Mashuri. How are you doing, Dr. Ain?
I'm doing good, thank you.
Our issues for today is mental health, anxiety disorder. Ladies and gentlemen, anxiety disorder is a type of mental health condition. If you have an anxiety disorder, you may respond to certain things and situations with fear and dread. You may also experience physical signs of anxiety, such as pounding, hurt, and sweating. For the detail about this topic, I would like to seek an information from the first panel, Dr. Emanuel, as an psychiatrist. What are types of anxiety disorder?
Okay, thank you, Azrai. Okay, first of all, good morning to Madam Noriza and fellow attendees. So back to the question. So what are the types of mental anxiety disorder? So in my experience as a psychiatrist, there are many types of mental anxiety disorder. But for this morning, I'm going to only share 5 types of mental anxiety disorder. So the first mental anxiety disorder is a generalized anxiety disorder, on in the simplest form, we call it as GAD. So GAD is an anxiety disorder that can characterize by a chronic anxiety, exaggerated worriness, and also a high level of tensions. So the person might suffer from GAD, although they did little or nothing to provoke it to happen. So this type of person, this type of patient is actually an easy to get this type of anxiety disorder. So the second type of mental anxiety disorder is an obsessive compulsive disorder, or OCD in the simplest form. In our medical terms, always call it as OCD. Is an anxiety disorder that is characterized by recurrent, unwanted thoughts, or we call it an obsession, and repetitive behaviors, and so we call it as compulsions. Repetitive behaviors such as always washing their hands, always counting, always checking upon something, is often performed just to distract that person from their obsessive thoughts, or just to make them go away. Now, these acts is actually just to provide them only a temporary relief, and not doing so will markedly increase their anxiety levels. Now, the third types of mental anxiety disorder is panic disorder. So, panic disorder is an anxiety disorder that can be characterized by unexpected and repeated episode of intense fear. Now, the person may include a physical symptoms such as chest pains, heart palpitations, shortness of breath, dizziness, and also abdominal distress. Now, the fourth types of mental anxiety disorder is post-traumatic disorder, or PTSD in the simplest form. So PTSD is an anxiety disorder that can develop after that person is exposed to a terrifying event or in ordeal in which physical harm to that person, or if that person was threatened before in their life. So, traumatic event that can trigger PTSD is such as violent personal assault, human or natural cause disasters, traumatic accidents, and lastly would be a military combat experience in most of my cases that I have treated before. Now, the last one, or the fifth one of types of mental anxiety disorder, is social phobia, or in a medical term, we always call it as social anxiety disorder. Now, social phobia is an anxiety disorder that can be characterized as overwhelming anxiety or excessive self consciousness in everyday social situations. So, social phobia can be limited into only one type of situation, such as fear of talking in front of others, talking informally, whether it's informally in a everyday social situation, or fear in of drinking, fear of eating in front of any others. They just very social phobic, like very phobia about it. Now, in most severe case, the person might experience such symptoms, any of the social phobia symptoms, at any time when they are around other people. So that is very common when I treat it among my patients, and most of my patients are students and society of people. So yeah, I think there are five types of mental anxiety disorder that I can share with you guys. So I give it back to our moderator. So Azrai, thank you.
All right. Wow, give a round of applause to our Dr. Emanuel for giving an interesting insight and diving deeper for this topic today. Next, I would like to invite Ms. Afiqah, one of the survivor patients from anxiety disorder. Ms. Afiqah, can you share your experience and or symptoms that you faced before?
First of all, thank you to our moderator. Yes, I'm one of the survivor anxiety disorder. Hi everyone. There are 5 symptoms that I got, which is traumatic change in sleep, short of breathing, overwhelming worry and panic, unstable mood, and muscle cramp or shivering. Okay, actually, I was diagnosed as anxiety when I was 18. At first, I had a symptom where I could not breathe properly. Like I only can breathe half, like shortness of breathing. Then I feel weird. Why I'm like this? So at first, I just ignore it, but over the time, the symptom got worse, which is I start to experience a dramatic change in sleep. I can't sleep. I have to take some medicine or sedative pill so that I can sleep. I have experienced not to sleep for 3 days in a row. And then if I in the place with a lot of people, I would start feel short of breathing, feel like the place was very narrow. It feel like I was about to die. I was about to die. Um, after that, I start looking for this disease on my internet and ask my friends if they have feel like I did. Until at the time I thought I had a cancer and could not live for a longer time anymore. Also, this symptom is called overwhelming worry and panic. It means being too worried about nothing, about something even though it's normal. Then I start to see a doctor, but some doctors said, you're just fine, you're okay, you're not sick. This is because mental illness is something that cannot be seen with the eye, unlike a common illness that can be checked on the body. But I know that I'm sick. I can feel my body not same like before. Then I start cannot control my emotion. Even with just a little stress, my mood will be so unstable. Um, I want to be everything perfect. They know, and they can be no shortcoming. So my best friend suggested me to see a psychiatrist. I still remember I see her in her office. She handed me a piece of paper which stated that I was diagnosed with anxiety. After that, the secretary guided me to learn to calm down. But sometimes, if I got stressed or uncomfortable with something, my body will start pounding, goosebumps, and shivering until I cannot sleep. If I fall asleep, I'm afraid that I will die. But now, thanks goodness, I can control myself and live normal like everyone else. So that's it of my story about the symptoms that I have experienced. Okay, that's all. I will pass to our moderator.
Okay, thank you for sharing information and experience, Ms. Afiqah. I wish you good health, happiness, and successful in your life. Anxiety disorders are like information and experience. Anxiety disorders are the form of mental illness. They don't come from personal weakness, character flaws, or problem with upbringing. Let's invite our psychologist, Dr. Eva, to share about causes anxiety disorder.
Okay, yes, sure. First of all, thank you for inviting me here. Okay, now what are the causes and anxiety disorder? I think there are many causes that can make someone feel anxiety disorder. But this morning I will mention three main causes and anxiety disorder. Okay, one of the causes is traumatic events. What is a traumatic event? Okay, traumatic event is an incident that causes physical, emotional, spiritual, or psychological harm. A traumatic event can lead to mental health issues such as post-traumatic stress disorder or simple words PTSD. Okay, it's about something that makes someone feel anxious for a year after the trauma. When you experience a traumatic event like psychological, physical abuse, bullying, disaster, or other traumatic experience lead to develop an anxiety disorder. Okay, next is stress. It also can be associated with the development of anxiety, whether it's a major stressor such as a serious illness or the ongoing caused by work issues, financial, family conflict, and chronic health problem. I believe everyone already experienced the words we call stress, right? As my experience, stress will affect us such as irregular eating, not enough sleep, alone, lazy, and so on. So actually, if we can't control our emotion, it's a big issue or problem for us because if the situation uh, persists, that will make a person to get an anxiety disorder. Okay, last but not least is family history. Having a family member with an anxiety increase an anxiety disorder. Although this may suggest genetic transmission, there is also the possibility of learning anxious response from family member with anxiety. For example, our parents have their own character, like they're easy to get angry to their child or don't care about their child. So it will make they feel anxiety disorder because we are fear to them. Okay. Other than that, if we have a broken family or divorced parents also can influence the group member of your family to have an anxiety disorder. Okay, that's all I can share for this morning. Thank you. I will give back to the moderator.
Right, thank you, Dr. Eva, for your explanation. That's so clear and easy to understand. Everyone has anxiety from time to time, but chronic anxiety can interfere with your with your quality of life. Miss Shantini, can you share the effect of anxiety to our body?
Yeah, sure. So the anxiety disorder, just as our panelists say, one of our panelists say, Dr. Ms. Afiqah essay that anxiety disorder is as much effects on our body. So uh, as we know, there is an area of in our brain that changes the emotional responses and play a crucial part in developing feelings of fear and anxiety. And as we know, uh, there are three main effects of anxiety disorder on our body, such as breathing and respiratory changes, impact immune system, and changes in digestive function. So, uh, breathing and respiratory changes is occurs when our breaths become rapid and shallow, which causes to hyperventilation. And hyperventilation occurs when we are not getting enough of oxygen, as someone who has anxiety disorder, or we are gasped from our breath. So this can worsen the hyperventilation disorder with some of the symptoms such as dizziness, um, lightheadedness, and weakness. And next is uh, impact immune function. In short term, anxiety boosts the immune system's responses. So, however, the prolonged stress can have the opposite effect. People with chronic anxiety disorders may likely to be common with some f- uh, cold, flu, and other types of infection. Cortisol prevents the release of substance and that causes the inflammation, and it turns the aspect of the immune system that fights the infection and impairing the natural immune responses. Then the changes in digestive function. Cortisol blocks the processes that body considers as not essential in a fight or flight situation. On one of these block the processes of digestion, and also the adrenaline reduces the blood flow and relaxes the stomach muscles. As a result, a person with anxiety may experience nausea, diarrhea, and a feeling that stomach is churning. They may also lead to loss their appetite. Stress, depression are linked to several digestive diseases, including irritable bowel syndrome, known as IBS, which the anxiety and depression are common in people with uh, irritable bowel system disorder, IBS. So that's all from me. There are also several other effects of anxiety disorder on our body, but due to time management, I passed the session to our moderator. Thank you for inviting me.
All right, thank you, Ms. Shantini, for the very encouraging information you shared. As we know, every problem has a solution. Dr. Ain, can you share about the treatment for the anxiety disorder?
Sure, Ahmad. Thank you. That is very true indeed. There's a solution to every problem. I agree with you on that part. Even though technically anxiety is not exactly curable, but there are ways to keep it from being a big problem, which is why getting the right treatment is very important as it will help you dial back out of your out of control worries so that you can get back with your life. So generally speaking, there are two types of treatments for anxiety, which are psychotherapy and medications. You may benefit most from the combination of both, but it may take some trial and error to discover which treatments work best for you. For psychotherapy, it involves working with a therapist to reduce your anxiety symptoms. Um, Psychiatrists, psychologists, and other mental health professionals use several types of anxiety therapy, and the choice of therapy also depends on your diagnosis and um, your severity of your anxiety. All right. One of the most widely used treatment is called CBT, which is also known as cognitive behavioral therapy. It is a talking therapy that can help you manage your problems by changing the way you think and behave. Through this treatment, patients learn to understand how their thoughts contribute to their anxiety symptoms and how to cope with them. By learning the change by learning to change those patterns, thought patterns, they can reduce the likelihood and intensity of your anxiety symptoms. Um, all right. So secondly, for medication, medication is of course known to be safe and effective. The four major classes of medications that are used to treat anxiety disorders are SSRI, SNRI, um, tri-sleep antidepressants, and benzodiazepine. The first-line drug treatment for anxiety is SSRI. They work by stopping the nerve cells in the brain to um, from reabsorbing serotonin, which is a chemical that plays a vital role in mood regulation. It affects your brain brain chemistry by regulating mood and anxiety. So these are the basics that you need to know about treatments for anxiety. Back to you, Ahmad.
All right, many thanks for advice and treatment sharing. Next, we will jump to the next session, Q&A session. For the first question, generalized anxiety disorder and panic disorder seem to have similar symptoms. What about the triggers and the events that cause them to happen? Are they the same? To answer this question, I will pass it to Dr. Emanuel.
Okay, thank you, Zulazraie. So about this question, so the question asks whether GAD or generalized anxiety disorder and panic disorder seem to have similar symptoms. Well, yes, they have similar symptoms. Now the second question, what about the trigger and the event them to cause them to happen? Are they the same? Well, it's actually a bit different, but the symptoms is actually identical. So what makes this two anxiety disorder difference? As I mentioned before, GAD, the person that suffer from GAD is the person that immediately showed symptoms of anxiety disorder, or whether they did little or nothing about it. Like even at a small level of distress, small level of circumstances that creates a critical situation, they will immediately suffer from anxiety disorder. Now, compared to the panic disorder uh, will happen if it happened repeatedly, because as I mentioned before, it can be characterized as repeated episode of terrifying event. So panic disorder is something that will happen if it happened repeatedly. Whereas GAD, it will happen anytime, even in a small level of tension, small level of distress. So I think that kind of thing that differentiate GAD and panic disorders. So yeah, that is my answer to that question. Thank you.
Okay, thank you, Dr. Manuel. For the second question, panelist 2 said that many doctors said that she was experiencing nothing serious. What is your advice for people who are suspecting that they are having anxiety, who wants to seek treatment? What are the correct steps? Miss Afiqah, can you?
Okay, I will answer the question two. Yes, that's true. I went to see a doctor, and some doctors said there's nothing serious. But my advice for people, for you guys that have symptoms of anxiety, the first step, if you are still student, you should go to see a counselor because every institution has a counselor. If not, you must to see a psychiatrist. And then you need to accept the view and the treatment that psychiatry gives to you. It's because some people think that they are crazy, but it's not. You are not crazy. Just you have a mental illness. So you have to accept the treatment. Most importantly, you need to be around positive people. Support from the loved one is very helpful. Okay, that's all my answer.
Okay, thank you, Miss Afiqah. The third question, can you give us some advice on how to handle our stress so that we'll not be overwhelmed by it?
Okay, thank you.
Anyone?
Okay. Okay, thank you. I think I have some advice to handle our stress. First is we can get exercise or go to exercise because I think it's a best way to relax your body or mind. For example, we go to jogging, jogging 2 or 3 times in weeks. Okay. Second is eat well. So I think eat well should be the best. Should be the best advice also um, because I think when we eat well, it's make us to relax. So, for example, you meal should full of vegetable, fruits, or protein for your energy. Okay. Third one is talk about your problem. So I think talk our problem can make us more feel better. For example, we talk to our friend, family, or other than that. So it can make help us to make a good decision. Thank you.
Thank you, Dr. Eva. Question 4. Panelist 4 have mentioned the effects of anxiety disorder. How would that affect our everyday life activities? Miss Mohshanthini, please.
Yeah, thank you for the question. So, and how the anxiety disorder affect our daily life? Just as one of the panelists has said, Miss Afiqah had said that she feels suffocating, that until she had a thought that she wants to die, and she can't sleep in the night because she thinks that she might not awaken the next morning. It's a it's a common anxiety disorder that which make us anxious for our life. And yeah, we are the one who's living our life. No one is helping us. That's the common thought that whom have some thoughts of the anxiety disorder. Like they have to continue with their life. They might scare their life will be ruined if they depend on others. Like and they have to do everything by themselves, and that's the main causes that affects our daily life, and it can lead them to feel depressed, and the depression can lead to the anxiety disorder, and it can be very chronic, which makes our breathe, we gasp for breathe, like we are someone is suffocating, someone is strangling us with, and like won't have any appetite, and won't have any appetite means that we have no food, and it can affect our daily life with no energy. And immune system, it can also affect our immune system. Like we have we are commonly falling sick, which affects our daily life. Like we are having cold and something like that, which leads to the effects in our life because of anxiety disorder. And yeah, that's all from me. I pass to the moderator.
Okay, the next question. Is there any instant cure that can be used to overcome anxiety?
Thank you, Ahmad. Um, so like I said earlier, there is no cure to anxiety. However, you can try coping with them instantly by taking a walk, doing yoga, exercises like that. You may also practice focus deep breathing. You can like always remember to breathe when you're having your panic attack. Stop for a moment and focus on breathing deeply and correctly. Um, my other suggestion would be taking a mental step back, because anxiety tends to um, mess up with your brain and how it functions. So you just, uh, I would I would advise you to try calming yourself and meditate. You can also reach out to your friends, call the people that uh, call your friends that you believe would be able to handle you. And last but not least, write down your thoughts and to just express your feelings on a piece of paper, so you can be focused and like um, not be affected by your surrounding as much. That is all from me. Thank you. Back to you, Ajay.
Thank you, Dr. Ain. Okay, the last question. Anxiety disorder seems to be increasing now. It compared to 5 years ago, for example. Can you explain why this happens? So I will try to answer the last question and jump to the conclusion. People seem to anxious to run for their life. This can lead to anxiety disorder, especially on this era globalization. People tend to care about their well-being, which makes them run for their family, themselves, and for society. In my opinion, this is one the causes that anxiety disorder. In conclusion, when coping with daily challenges and issues, anxiety is a frequent feeling. Anxiety becomes a condition when these emotions are persistent, excessive, unreasonable, and interfere with a person's capacity to perform. Anxiety disorder are classified into several kinds, including phobias, panic, stress disorders, and obsessive compulsive disorder. Although there is no way to foretell what may lead someone to acquire an anxiety disorder, we can take action to minimize the severity of symptoms if we are concerned. Get help right away. If you wait, anxiety, like many other mental health issues, can become more difficult to cure. It can become more difficult to cure. Continue to be active, engage in things that we like and make us feel good about ourselves. Enjoy social engagement and living connection which may help to alleviate our anxieties. That's all for today. Thank you.